Hello students, we'll discuss a traumatic condition today. What this condition is. Look at that. In the thigh, you can see the knee joint here. You can see the thigh. Obviously after a blunt trauma, there is discoloration so much and there is a swelling. Probably the skin discoloration is there. Must be soft, maybe fluctuant, tender. Because of trauma, it is bruises you can see there. So that is the very typical. So what this condition is, it is hematoma thigh, quite large hematoma. That means there is some oozing which has clotted and caused this collection. Now important thing you have to remember is whether it is in which plane. There is no confusion about diagnosing hematoma clinically. This one very clear cut. Clinically it is evident. Which plane it is, whether it is subcutaneous plane, whether it is a deep to deep fascia, whether it is in the muscular plane, and much more importantly, whether major vessels are involved or not. Because in this area, femoral vessel ends there near the apex of the femoral triangle, and such are branches of femoral vessels, or whether it is involved. So major vessels or veins or arteries are involved or not is one another thing. Which plane it is to confirm is important. So naturally, you have to examine the patient, distal pulse, edema is there or not, systemic examination, and assess the patient clinically also. And over that, then you have to evaluate the patient by ultrasound imaging basic, arterial and venous Doppler, both. It will say whether major vessels are normally functioning or not, flow is adequate or not, or it is compressing the swelling or not. And additionally, you have to do MRI to have a clear cut image of that. And trauma may be there, or fracture may be there due to trauma also there. Can be assessed clinically always. If it is so, of course, X-ray, MRI will clearly tell what exactly. Most important thing is which plane this hematoma is, should be assessed clinically, and whether it is communicating to the deeper plane. Accordingly, you have to evaluate. Accordingly, you have to plan treatment. So if it is superficial, easier. If it is deeper injury in the major vessels, needs a vascular surgeon's intervention, needs to think and plan, maintain the perfusion distal part, needs blood transfusion, becomes a major procedure to save the limb, save the vessel, correct the problem. So there is exactly this hematoma is very important. Hematoma can be in the different plane, can be intracranial, can be intrathoracic, can be intra-abdominal, can be organ hematoma, can be deeper plane hematoma, can be superficial hematoma. So anywhere hematoma can occur. But again, other than trauma or with the trauma, if patient is on anticoagulants, so blood thinners, so like ecosprin or clopidogrel or heparin in admitted patient. In such a patient, hematoma can occur, and you need to know because control of the bleeding may be a little difficult in such patients. So those history of intake of anticoagulants is very important in this patient, because many patients take ecosprin, aspirin, called dose, and clopidogrel. So that history may be very relevant in such a patient, especially trauma with hematoma. So all these things are whatever I have told: discoloration, pain. You have to palpate the area for thrill, and you have to auscultate the area for bruit. So that gives the flow. The flow, stenotic flow is there or not. So thrill, rapid flow thrill occurs in thyroid, muscularity, hypervascular areas, whereas in traumatic stenosis, if there is a narrowing, thrill and bruit can be held. Doppler, MRI is a must. So some CT angiogram sometimes you have to do in these patients. To this one, so treatment depending on the situation. Initially conservative treatment, ice pack, a compression bandage, then assessment of the patient. Especially that is useful only in the subcutaneous plane or superficial plane where major vessels are not injured. But once it is big, when it is not settling down or if infected, then you have to drain it under anesthesia, spinal anesthesia in the limb or general anesthesia elsewhere, and you have to evacuate the clot. But again, assess major vessels are involved or not. That point is very, very important if it is so called the vascular surgeons. You can always aspirate under guidance if it is clot not being infected, so that whether it settled down on its own without any surgical intervention. So this point is very important. Hematoma is a short note. It's a clinical entity. You know how to manage these patients. Large hematoma, you should admit the patient, monitor the patient. This is a point which you have to remember always. So answer this MCQ, student. Early stage trauma is characterized by A. Catabolism, B. Anabolism, C. Glycogenolysis, D. Lipolysis. So put your correct answer in the comment box. I will give the right answer eventually. So please go through my clinical methods in surgery for how to examine all these clinical patients in detail, and my manual detail about all the trauma and everything covers all CBM syllabus. My operative surgery details all operative techniques with the 2 volume books and tissue approximation. Diginor lectures through JP. Everything it covers for UG instrument, specimens and specialties. So students, I hope you have understood this hematoma topic very well. Thank you very much.